This is
Make it plain.
Make it plain.
MIP
With Masamela Matfumo.
Mark Thompson.
Make it plain.
Get woke.
Ladies and gentlemen, with all that's going on with the Delta variant, and I guess the looming Lambda variant, we're not out of the woods yet. We have a bit of news, and who better to bring it to us than the White House Vaccination Coordinator himself, Dr. Bechara Choucair, joins us on Make It Plain. Dr. Choucair, thank you for joining us.
Thank you, Reverend Mark, for having me here. I'm really looking forward to our conversation.
And it's an honor to have you. So, man, what's going on? What's the latest? We need boosters?
Well, let me just start by saying that we know we have 3 effective and very safe vaccines here in the United States that are doing exactly what they're supposed to do, which is protecting us from severe COVID-19, including hospitalizations and deaths. Now, what we've been seeing in the data, what we've been learning from science is over time, the vaccine effectiveness is waning against infection, particularly mild and moderate infection, still holding up really well against hospitalizations and deaths. And so our medical experts, our public health experts are now recommending that we launch a booster program that we will be making available beginning September 20th for everybody who's gotten both doses of the Pfizer or the Moderna vaccine, and they will be ready for a booster shot 8 months after their second dose. So for example, Reverend, I got my second Pfizer dose on February 28th. So my booster shot will be due on October 28th, 8 months later down the line.
So you mentioned Pfizer and Moderna. What about the people who've taken the Johnson?
Well, we do believe that people who have gotten Johnson & Johnson will also need a booster at some point. Now, keep in mind, we've started administering Johnson & Johnson in March. So that was 3.5 months after we started administering the mRNA vaccine. So we're going to need a little bit more time to get the data, to get the analysis, to see what would it look like to have a booster shot for J&J. But we do believe you will also need a booster shot for the J&J as well.
Okay, very well then. And to be clear, is it the Delta variant itself that necessitates this?
Well, there are 2 things that are happening here that are important. Well, actually 3 things, Reverend. The first thing is we are seeing that over time, we are seeing a waning effect of the vaccine when it comes to infection. And that includes both symptomatic and asymptomatic infection. The second thing is we are seeing that the vaccine effectiveness is relatively high still for severe disease that includes hospitalizations and deaths. So that's good news. Now, we're also seeing, that's the third piece, that the vaccine effectiveness decreases with Delta. So because of all these 3 things, and because we want to stay ahead of this virus, that's why our medical experts, our public health experts are recommending the booster shot 8 months after your second shot.
More MIP after this message.
What about people, doctor, who've yet to be vaccinated at all? Would you still suggest they stay on the same schedule? Go ahead and get vaccinated. Get your first vaccination, but know that you may need a booster down the road as well. Or I guess even better question, if people are just getting vaccinated today, do you feel that that will hold them for the requisite, I guess, 8 months until they're ready for their booster? Do you feel they're protected enough against Delta?
Well, Reverend Mark, I'm so glad you're bringing this question. It is extremely important. It's more important today than ever for people who are unvaccinated to get vaccinated right away. I mean, just remember, we almost have 200 million people in this country with at least 1 shot of the vaccine. 200 million people. So I'm so excited about this. But the fact remains, we still have over 85 million people in this country who are eligible for the vaccine who aren't vaccinated. And for this group, they have to get vaccinated ASAP yesterday. they should have been vaccinated months ago, 6 months ago. It's really important that we get these folks vaccinated because the fact remains, if you're unvaccinated, you continue to be at risk of catching this virus. And unfortunately, you continue to be at risk of hospitalizations and deaths. And you look, Reverend Mark, you look at the overwhelming majority of hospitalizations in this country, they're amongst those who are unvaccinated. You look at the overwhelming majority of deaths in this country, they are almost all unvaccinated. So we know vaccines work. And for those folks to protect themselves, to protect their communities, to protect their families, they have to get vaccinated.
Yeah. No, you're absolutely right. And I guess we've all gotten a little lax. I think the thinking was, well, if so many millions of people are vaccinated, maybe the rest of us don't need to get it. And that's not the answer at all, is it?
Absolutely. We have to get everybody who's unvaccinated vaccinated. And look, I know that there are people who still have questions, legitimate questions about the vaccines. Hey, if you have questions, talk to your doctor, schedule an appointment with your doctor, talk to your friend, your relative, your faith leader, your community leader that you trust about their experience in getting them vaccinated. Listen to the stories of people who didn't want to get vaccinated and ended up in the ICU, intubated. Listen to the stories of pregnant women who are delivering babies, preterm babies, and getting into ICU and unfortunately dying from this disease. We have to get people vaccinated. This is our best path to putting this pandemic behind us.
More MIP after this message.
Dr. Choucair, thank you so much for enlightening us. And this will happen in September, correct?
Correct. So the booster program will not start until September 20th. So nobody should rush to the pharmacy or rush to the doctor to get a booster shot unless you have a compromised immune system. And that announcement came last week. So if you have had organ transplant or bone marrow transplant, if you are getting treatment for cancer, if you take some medication that lower your immune system, you absolutely need to get your third dose. And those folks are eligible right now to get their third dose.
No, that's right. Very important, folks. I hope you hear this. Let me also take the opportunity. Did I free? Okay, I'm sorry. But folks, this is very important. Let me also take the opportunity as we go, Dr. Choucair, and hopefully we can leave with me being on your absolute good side. I am one of the organizers with a number of groups organizing the anniversary of the March on Washington at the Lincoln Memorial, August 28th. And for the first time, it necessitates it. At the march, we will be offering COVID testing and vaccinations with the help of George Washington University Hospital. So I want everyone to know that if you come to the Lincoln Memorial on August 28th and you're not vaccinated, you can do that right there on the spot. So this, as the doctor said, this is very important. I know we got to go, but last thing, everyone I've talked to in your field had said something to me, and I just want to see if you agree. This thing is with us, man. I mean, this may be like the flu. This may just be with us from now on, and we have to be prepared for. We're moving into a new era of humankind where we're going to have these types of diseases just with us, and we can't pretend like they don't exist. We've got to address it. Do you agree with that assessment?
Well, we have a path to get many, many more people vaccinated. That might change that. Unfortunately, at this point, we just have to wait and see how this virus does. This is a very unpredictable virus, and we're going to have to stay ahead of the virus. That's why we're launching the booster plan today.
Yes, sir. Yes, sir. Thank you, Dr. Choucair, Dr. Bechara Choucair, the White House Coordinator of Vaccinations. We appreciate you joining us on Make It Plain. Keep up the good work, sir. And please keep us posted and continue to give us instruction about what we're supposed to do with ourselves.
Thank you for everything you do, Reverend. And so glad you got a chance to invite me and got a chance to spend time with you and your audience.
Wonderful.
Thanks for getting woke and listening to Make It Plain. Please remember to listen, like, and wherever you get your podcasts, please give the show a 5-star rating. And please do spread the word. Let's all continue to pray for each other during this pandemic and this police-demic. If all hearts and minds are clear, it has been made plain.